Hi, everybody. Welcome to today's webinar. I am Gillian Plant. I'm here representing Delta Omega, the 100-year-old Honorary Society for Public Health. Go ahead and share with us in the chat where you're joining us from, and then we'll get started. Oh, also, I'll go ahead and share. Again, this is part of our professional development webinar series. You can see the full series here. You can sign up for future ones and see past ones from that page. We're very happy to have with us two experts in their field and in public health, Chirine Chehab and Brittaney Bethea. Bethea?
Bethea.
Thank you. Sorry about that. Um, I will be here monitoring the chat. If you have any questions, please put them in the Q&A. You'll see that at the bottom of your screen. And I will not take any more of your time, and we will let Chirine start this program. Thank you so much for joining us today.
Thank you. One moment.
And now you just, presenter mode next.
Are you seeing my note?
Yeah,
What about now?
there you go.
Great.
Thank you.
All right. Good afternoon, everyone, and thank you for joining today's session. My name is Chirine Chehab, and I work at the intersection of public health informatics, health strategy, data standards, and evidence-based decision-making. Over the past 15 years, my work has focused on healthcare and public health systems, also clinical operation, interoperability, data modernization, and helping organizations use data more effectively to improve health outcomes. So one thing I've learned throughout this work is that data alone doesn't create impact. And people act when they understand what the data means, why it matters, and what should happen next. That is where communication becomes critical. And today's session is really about how we move from simply presenting information to communicating in ways that build understanding, trust, and action. So before we submerge into the content, please note that, this is a standard disclaimer displayed on this slide where the finding and conclusion shared today represent my professional insights and do not necessarily reflect the official positions of my affiliated organizations. Also, I would like to highlight that in the spirit of technological transparency, AI tools were utilized to help visually organize and draft some of my diagrams and these presentation frameworks, such as ChatGPT, Gemini, and others. Oops, sorry. So our roadmap for today's webinar is a little bit comprehensive. So we are going to establish exactly why writing acts as the bridge between raw data and real-world health impact. And we will dissect how public health writing fundamentally differs from other writing styles. I'll share strategy for managing data storytelling, leveraging plain language essentials, and avoiding the most common syntax and formatting traps. Finally, we will close by discussing how to choose the right data visualization and how to tailor information to highly diverse audience. And last but not least, how to safely navigate ethical communication and artificial intelligence in modern practice. So my goal is for you to walk away with practical, evidence-based tools that you can apply to your next brief, report, or manuscript. So let's start with a foundational truth. Good writing transforms data into insight and insight into impact. As public health professionals, we collect incredible amounts of robust data, but data sitting quietly in spreadsheets helps no one. Our writing is the vehicle that drives that data forward. So high quality communication directly informs policy and clinical decisions. When data transparently and empathetically used, it builds public trust, which we all know is a vital currency in health intervention. Also, clear writing drives timely action during emergencies, advances health equity by making complex guidance accessible to systematically marginalized communities, and of course promotes institutional accountability. So ultimately, your writing is just as much a public health tool as an epidemiological model or a vaccination clinic. So to write effectively, we must understand how unique our field's demands are compared to other genres of writing. So traditionally, creative or editorial writing is often opinion-based or focused on author expression. In contrast, public health writing must be evidence-based and audience-centered. We subordinate our personal voice to serve the immediate information needs of the reader. Furthermore, creative writing might seek to entertain. Public health writing is fundamentally action-oriented. It demands a clear next step to protect human health. We also center ethical and equitable framing rather than just trying to be purely persuasive. And we deliberately prioritize plain language over the dense technical jargon or prose that you might find in purely academic literature. We don't write to impress, we write to protect. Many people view writing as an innate, mystical talent. It is not. It is a structured operational process, and I recommend looking at it through these 4 distinct phases: planning, drafting, revising, and the final check. So during the plan phase, before your fingers even touch a keyboard, you must explicitly define your target audience, then clarify your primary purpose and isolate your key message. And then gather only the data that truly matters to that purpose. When you move to draft, focus on leading with your main point right away, using active voice and plain language, and anchoring your data with real-world examples. In the revise stage, you zoom out to strengthen clarity, ensure structural flow, check factual accuracy, and make sure the required public health action is unmistakable. Finally, is your final check should answer one simple, decisive question: would my specific target audience understand this instantly upon first reading? If the answer is no, it's back to editing. So one of the biggest culprits of writer's block is trying to draft and edit at the exact same time. And this is something that I learned and I advocate for a philosophy called fast draft, smart edit. So when you are working on your first draft, turn off your inner critique. Do not aim for perfection. Focus entirely on pouring your ideas into the pages, building the basic structure, securing your core message, and mapping out the storytelling flow. And I'm going to go over storytelling in my next slide. Once that raw material is done, you shift into the smart edit phase. This is where the magic happens. This is a cyclic workflow where you aggressively improve the text for clarity, convert passive sentences into dynamic active voice, smooth out your transitions, enhance readability scores, and cut away any filler words that dilute your impact. So remember, great public health writing is not written, it's rewritten. That's why first draft, then smart edit. So effective communication always starts with data mastery. And that's why we need to really understand and translate findings for others. So we must deep dive into the data ourselves. This means reviewing trends carefully to make sure we are not misinterpreting seasonal noise for statistical signals. Also, it requires us to look beneath aggregate numbers to identify patterns and stark disparities among specific demographic subgroups. Also, we must actively look for outliers that tell an unexpected story and constantly ask ourselves what matters most. Most importantly, ask, why should my specific audience, again, care about this particular data point right now? If you can't articulate why a metric matters to your reader, that metric shouldn't be the centerpiece of your document. So now, to weave data into an impactful narrative, I use the step-by-step data storytelling framework. And we start at level 1, which is the data. This is the raw baseline. What do the absolute numbers show? But numbers alone can be dry. So we immediately step into the insights. What specific pattern or correlation or even inflection point actually matters here? Next, we cross to the most critical bridge in public health writing, human impact. And we explicitly tell the reader who is affected. We turn percentages back into people, showing the real world lived experiences behind the statistics. And finally, we culminate this in action. Based on this entire trajectory, what policy, program change, or behavioral shift should happen next. This simple continuum ensures your data always serves as a clear behavioral and structural purpose. So now let's dive into the core mechanics of plain language and tone that we should include in our public health writing. And these are legally mandated for actually federal communication and practically essential for everything else. So plain language isn't dumping down content. It's a matter of precision. It means prioritizing everyday words, keeping sentences focused on a single idea, explicitly defining terms when they must be used, ruthlessly weeding out institutional jargon, and explaining statistical risks clearly and contextually. And hand in hand with plain language is tone. So your writing should be professional yet warm, deeply respectful, culturally competent, and intentionally positive and solution-oriented rather than, fatalistic. A great rule of thumb to center yourself is write exactly like you are speaking to someone you deeply respect. Make it clear and make it human. So let's look at some real-world tactical modification we can make by reviewing these common mistakes. And these are very general examples. So first, avoid vagueness. Instead of writing a weak, ambiguous phrases like many people are obese, give your reader exact, authoritative data. More than 1/3 of US adults are obese. Second, cut out unnecessary padded phrases. Delete filler, it is important to note that, and this is like sometimes common when we read manuscripts or some reports. So please delete these fillers immediately or entirely. Choose crisp, strong verbs, write use instead of utilize, and consider instead of take into consideration. Third, neutralize jargon. Instead of writing non-pharmaceutical interventions, medicated transmission dynamics, say something more accessible. Non-pharmaceutical interventions like masking and distancing help reduce disease spread. Fourth, monitor your tone. Instead of using sensationalized, panic-including phrases like, this disastrous epidemic is devastating communities. So keep it objective and professional. Communities continue to experience significant health impact. Finally, the last piece, solve acronym overload. So we have so many acronyms. So if your paragraph looks like an alphabet soup, like CDC, CMS, NIH, WHO, then pause. Define your acronyms clearly upon first use and use them sparing throughout the document. And this is a massive part of writing in public health practice, which involves choosing how to display data visually. So your text and your chart must work in perfect harmony. Always select your graphic format based strictly on your communication purpose. Again, audience, communication, tools. If you are trying to display a trend or a change over time, a line chart is your best choice. If your goal is to compare like distinct categories, deploy a clear bar chart. And to show parts of a whole, use a pie or donut chart, but keep, of course, categories to a minimum so it remains readable, not very complicated or too dense. And when the audience needs to examine exact values or multivariables metrics, skip that chart entirely and use a well-structured table. To demonstrate relationship or correlations between variables, use a scatter plot. And finally, if you are illustrating geographic patterns or state-by-state disparities, a data map is incredibly compelling because you can show that comparison across the geographic locations. Never use a chart just to look pretty or colorful. Use it because it is the most efficient way to make your point stick. One size absolutely doesn't fit all in health communication or in public health writing. So we must adapt our style dynamically depending on who is reading, again, our audience. If you are writing for general public, and this is a piece that my colleague Brittany will be covering in the next part or next section of this webinar. So maximize plain language, keep your sentence structures incredibly brief, focus heavily on immediate personal benefits or protective action they can take, and anchor it with strong visual aids. And if you are writing this for policymakers, their currency is time and utility. They need clear structural implication, public health implications right up front, explicit pairing of evidence with socioeconomic impact, unambiguous recommendations, and highly concise executive layouts. And finally, if you are writing for an academic or technical audience, such as peer reviewers, manuscripts, or for epidemiologists, you must shift to detailed methodology focused on mathematical rigor, transparently discuss nuances, and of course, data limitation. And use precise technique terminology as needed. So same data, 3 entirely different execution strategies. So as public health practitioners, we must realize that language is deeply intertwined with systematic equity. So ethical and equitable writing requires us to move away from stigmatization, deficit-based language, and move intentionally toward person-first, asset-based framings. For example, we don't label people as the undocumented or diabetics. We speak of individuals navigating undocumented status or people living with diabetes. So we must also ensure that our writing doesn't inadvertently blame individuals for systematic health disparities. So our writing should be transparently named the structural determinants of health, such as redlining, environmental justice, or lack of resource allocation, rather than framing a community's elevated health risk as a personal or moral failure. So ethical writing means documenting data accurately while honoring the dignity of the human beings behind those numbers. And before we conclude, let's address the elephant in the room. So the AI tools like large language models, LLM, are transforming how we outline, brainstorm, and process information. And this is everywhere in all disciplines, not only in public health. However, in public health writing, AI can be a magnificent administrative co-pilot. It can help generate initial plain language summaries, suggested structured outlines, or help brainstorm titles. However, AI cannot think for you. And it certainly does not understand public health context intuitively. So you must never feed appropriately or confidential or protected health information into public AI models. Also, keep in mind that because AI can occasionally hallucinate data or introduce subtle, biases, and this is evident in different articles and literature review, every single line of output must be rigorously validated, fact-checked, and refined by a human expert. So use AI to optimize your workflow, but rely on your own training, equity, frameworks that are evidence-based, and scientific expertise to protect the truth. So as we prepare for our Q&A session, let's review the core takeaways from today's webinar. First, always remember that public health writing is a formalized, systematic process following different frameworks and processes. So dedicate real time to planning and structural editing. Second, use the data storytelling framework to connect your numeric data points directly to human impact and concrete policy actions. Third, embrace plain language and empathetic tone as non-negotiable tools for equity and clear execution. And finally, Tailor your format and visual data tools precisely to match the needs of your different audiences. And thank you. Any questions? I hope I'm on time.
We're doing just fine.
Perfect.
Brittany, if you'd like to join us.
Thank you. So I will go ahead and share my presentation. And if someone can give me a thumbs up just to make sure that you can see it.
Thumbs up.
Awesome. All right. Well, thanks everyone for joining today. I'm really excited to spend some time talking to you about something that I feel doesn't always get enough attention in graduate training and just public health practice overall, and that's writing. Many of us are trained to conduct research and analyze data and also generate the findings, but translating that work into something that people can understand and act on is a very different skill. So today we're exploring how to move beyond just simply reporting those results and thinking more intentionally about writing as a tool for influence and then also impact. But before we dive in, let me briefly just introduce myself and the lens that I'm bringing to this conversation. I come to this topic with somewhat of a hybrid background. Part basically public health practitioner is where I started my career, like many of you in a public health program, and then as a fellow at CDC. But as my career progressed, I started to have a real interest in how do we tell stories? How do we amplify voices of those in the community that are not often heard? And how do we influence organizations, policy decision makers, and just our general colleagues to try intervention approaches in communities that are going to have the greatest impact? So I've worked across various different settings, including federal agencies, healthcare organizations, nonprofits, and even academic spaces. But one thing that I've consistently seen is that great ideas and strong evidence don't automatically lead to that change that we want to see. So the work often soars based on whether or not the information is actually communicated in a way that resonates with the intended audience. And so that's what really drives my interest in public health writing and the lens that I bring today in our conversation. So there are three things that I want to leave you with today. So first, I would say a simple framework for approaching writing from an audience's perspective. And then second, some practical techniques that you can use to immediately make your writing stronger. And then lastly, I do want to share a couple of resources from various organizations that you can use in your writing starting tomorrow. So my goal isn't to turn everyone today into a professional writers overnight, but ultimately to give you some tools and some resources that you can start using immediately. So before we get started, I do just kind of want to talk about the backdrop of why is public health writing so important. I think most of you all know that the writing that we do in the field is much bigger than just our papers or our reports. The way that we communicate can really influence policy decisions, funding priorities, and even just general public understanding around different public health topics. It affects whether programs get implemented and whether communities engage with the information as well. And ultimately, communication shapes our health outcomes. People, they rarely act because data exists, but they act because information is presented in a way that feels relevant to them and meaningful. So I wanted to pose this question. Can anyone think of an example where communication or miscommunication changed the public's response to a health issue? I'll let you think about that, and you can drop anything that comes to mind in the chat. Of course, the primary example that comes to mind for me is probably just coming out of the COVID era. I think that there's lots of lessons learned that we could take from that experience going through a pandemic in terms of what was communicated, when, how it was communicated, who it was communicated to, and what were some of the health outcomes that we saw. Even though writing is really central to our work, many people don't always necessarily feel confident in doing it. So many public health professionals feel comfortable with research methods and analyzing data and writing to report on that information. But when it comes to challenging translation of that work, there are questions that start showing up like, how much detail is too much? How do I simplify this without oversimplifying? How do I explain why does this matter? And perhaps the biggest challenge is saying more with fewer words. Part of that challenge comes from the fact that we aren't writing just one type of content. And I would add that even in this digital age, we're seeing that there's so many different communication channels, right? And we're competing with a lot of information from other organizations, from other influencers, from various different types of digital formats. And so, what is it that we can do to try to capture someone's attention and have it be something that's relevant and memorable for them that makes them want to actually act on? So I want to highlight some of those formats. I mean, I think that as students, as graduate students, or even undergraduate students, you've probably heard of some of these or seen some of these. But you may write a journal article one day, for example, something that your professor says that this is a really great paper that you wrote, and perhaps you should submit it to a peer-reviewed journal. But perhaps you have a research assistantship or even your first job out of graduate school where you are tasked with writing some social media content. So the key to remember is that each format really serves these different purposes and may have different audiences. For example, a research article may aim to build evidence, while a fact sheet might aim to inform and educate, versus that social media post might aim to drive engagement or action. So the message itself may stay the same, or it might have shifted or adapted for a particular audience or a particular format, but the delivery should change based on who it is that you're targeting and where. So how do we know where to start? This is the framework that I was mentioning. I really like to use it as just a simple audience-centered framework before starting to write anything. You can basically pause and ask yourself these 4 questions, or your colleagues, your team members, if you're on a group project. These are some 4 essential questions that I would recommend. Once we know who we're writing for, then we can start thinking about the structure. And essentially, those questions are, who is the audience? Now, you'll probably hear a lot of people say, oh, the audience is the general public. I actually try to encourage individuals to think a little more strategically in terms of exactly what does that mean if you were to distill that down. So, for example, is this for individuals who have low health literacy levels? Or is this for a particular group of individuals who have a chronic disease diagnosis like diabetes or heart disease? Or is this someone who, or is this content for people who, for example, need to be motivated to exercise more? Or are they already pretty centered around the value of exercise on a regular basis? So you can think about, describing your audience in a wide variety of ways, whether that be age, race and ethnicity, cultural background, religious leanings, political, preferences, diagnoses, where they are on a, journey to behavior change. There's so many different ways to really think about how you describe that audience and then tailor what you're writing for them. But once we know who we're writing for, like I mentioned before, we can then start thinking about the structure of what we're writing. So one structure that I frequently use is this 4-part approach, where essentially you kind of start with the problem, which is not unique to plain language writing in public health. This is actually very similar to you writing your research paper, right? You start off with your introduction and your background, where you're really describing that problem. And then I would say transitioning from that to really distilling, well, what issue is that focus? What are we trying to solve? Most of us know that public health problems or issues or challenges, they are very complex, right? So usually they're connected to some other issue, or they have a domino effect with something else. But, for focused writing, you really want to try to tackle, one key issue that you want the reader to really hone in on. Then you can move into your evidence. So sharing or summarizing, what do we know now? And then what are those implications? Why should anyone care? How does this impact people at the individual level? How does this impact people across the state? How does this impact the national or the federal landscape around this particular issue? And then ultimately, what should happen next? What are you recommending? What's the action piece? Is where many writers kind of stop short. And so we want to explain the findings in terms of what we know, but we don't always tell readers what those findings mean for decision making. For example, maybe you want to promote a particular policy, or perhaps you want to engage people to attend a particular event so that they could learn more, or perhaps you want them to tune in to a program where they are getting to, learn from various perspectives about this issue. There's all types of calls to action, but I certainly would emphasize to make sure that you include one. Now, I want to transition to talk a little bit about some practical ways to make your writing stronger. Clarity doesn't mean oversimplifying. I think that a lot of us are very passionate about the work that we do and want to make sure that we don't oversimplify the issues that we're tackling because they're super important. They impact so many different people and they really drive the work that we do. But it can mean basically reducing unnecessary effort for your reader. So plain language is a really powerful approach to do this. And I would recommend that you lead with the main point instead of making people kind of sift through your content to find it. One of the other recommendations that I have is just using active voice wherever possible. And one of my favorite editing techniques is asking, if I remove this sentence, do I lose the meaning? If not, then we can cut it. So strong writing is often less about adding more and more, but about removing what isn't necessary. So this is an example of using a passive versus an active voice. It clearly identifies who is taking the action, and it tends to be shorter and easier for broad audiences to read. It strengthens accountability and clarity in reports or grants, manuscripts, and even health communication materials. I'd even extend this to say, as we know, the media is taking a very prominent role in educating individuals in our communities. And so when you're sharing information about a particular health topic, a disease, an issue, and the media is partnering with you to share information with the community about it, or they've taken an interest in it and they're asking you as a subject matter expert, you also want to think about passive and active voice as well. Here you can see with this example, it says in the passive voice, hypertension screening guidelines were implemented across community health centers to improve early detection rates. But in the active voice, it says community health centers implemented the hypertension screening guidelines to improve early detection rates. So it's very clear on who exactly is taking the action. I wanted to also share this example too, related to jargon. In public health, we have a lot of words that mean a lot of things, and they're very important. I think as my colleague earlier shared in academic writing, for example, you're going to have a lot of jargon that means a whole lot for us. We've gone through our education programs and we have peers and colleagues who use these terms, and we speak each other's language. But once you come out of the ivory tower and you come out of your office where you work and you have to collaborate with individuals that work in different sectors, it would benefit us to actually think about how do we say this in the plainest way possible so that we can move people to action. One of the useful rules that I like to recommend is if a term would require that someone pause and ask, what does that mean? Consider replacing it, or at the very least, defining it. So here, this example shows the first sentence. It says, basically the intervention leveraged a multi-sectoral evidence-based framework to facilitate upstream social determinants of health, ultimately to mitigate strategies among disproportionately impacted populations. I'm sure all of you all know what that means, but someone from the media may not. Someone who's a community leader may not. Someone who is interested in supporting a particular intervention in terms of funding it, but doesn't come from a public health background, may not understand what all of these terms mean. And so a plain language version says, the program brought together different community partners to address factors like housing, food access, and transportation that affect health in communities facing the greatest health challenges. So as we wrap up, I just want to leave you with a few key ideas. First, good data alone rarely changes practice, but communication does. Second, the same findings may need to be written differently depending on who you're trying to reach and where. And then third, strong writing helps evidence travel farther. If our work never reaches or resonates with the people who need it, then even great research has limited impact. So lastly, I want to leave you with a couple of gems. These are a few resources that I've pulled together. Certainly not a reflection of the scan of resources that are out there in the field, but there are a few that I've used and would recommend that you keep in your back pocket. The first one is just a link to the Federal Plain Language Guide series. So there's these nuggets of guides that you can kind of take and piecemeal as you fill up your toolbox of resources that you want to lean in while you're still in graduate school or even as you enter your next roles. The second one is CDC's Everyday Words tool, and it's here at the bottom. Essentially, you'll see it says search for jargon or plain language words below. So, for example, you would be able to put in the word social determinants of health, and it will basically let you know here's a couple of other recommendations that you can use to swap that word out. The next one is also a CDC resource that I've used extensively. It's called the CDC Clear Communication Index, and it's basically like a scoring worksheet. It is a research-based tool to help you develop and assess your communication materials. And so the index basically has these 4 introductory questions. Those are then scored, drawn from scientific literature and communication. And then it helps you basically hone in on the most important characteristics of your communication work that will enhance and aid people's understanding of the information. So as you can see to the right, it asks you questions about who's your primary audience. It also asks you, do you know about their health literacy levels? What are their skills like in that area? And then what are you ultimately aiming to communicate? What's your primary communication objective? So it helps you as an individual or a team of, peers basically think strategically about what you're trying to do and for who before you start writing. Next, there's also this plain language for public health guide. It is developed by the Public Health Communication Collaborative. And I would actually highly recommend bookmarking their website because they often have webinars on this exact topic, not just plain language, but communication and public health overall. Lots of webinars, lots of guides and tools for you. And then last but not least, this is actually a summary of today's presentation that I gave. It's an infographic that I developed just as a tip sheet. You can print this out, have it on your desk, or, basically bookmark it again, for my website. And just keep some of these things in your back pocket as you're drafting your content, or if you want to evaluate your content after you've written it from a strategic lens. With that, I want to say thank you to everyone and open it up for questions. I really appreciate your time and engagement today, and I'd love to hear your thoughts or any challenges that you've encountered in your own writing. Please feel free to stay connected as we continue the conversation.
And Chirine, you can come back on camera as well.
I'm not sure why it's not allowing me to start the video.
Oh. Let me see.
I'm taking a look at chat. I don't see any questions just yet, but we'll continue to stay on. And, of course, if any questions come up in the future, you can feel free to email myself or Chirine.
Yeah, thank you. Now it's working.
There we go.
It's okay.
Brittaney, you were asked if you could share some of those links in the chat,
Sure,
if possible.
sure.
And I guess my question would be, where does plain language and people first language meet? Because a lot of times for people first language can make something very long?
Yeah, I mean, I think that ultimately you kind of have to think about first strategically, like what framework are you working within? Um, if you have to write something for a social post or an infographic or a fact sheet, you may have to think about, the length that fits into those formats. Um, I think that ultimately you can try to draft something for, comprehensiveness first, and then thinking about the framework that content goes in, thinking where you can trim. Or I've also seen a strategy where ultimately you think about things in, small bites. So it's a series of things instead of having to cram something into one product. Perhaps it's a series that you then launch. And again, that could be a webinar series, that could be a series of mini briefs, that could be a series of social posts. I think thinking about how do you extend that engagement is a good factor too. How do you keep people like wanting for more is an engagement strategy when you break things up that are long form into smaller bites.
And then Celine asked, best ways to submit to journals, editors if you're not affiliated anymore with an institution but want to still continue to publish.
Yeah, this is a very challenging question. Actually, for many public health leaders who are not affiliated with a specific organization. So sometimes it depends on the journal. Some journal mandate that you are affiliated with an organization. So even if you want to try to submit your individual work as a manuscript, it doesn't allow, unfortunately. But I think there are not many, and you can always try to collaborate and network because sometimes, um, like even from my own experience, even if you have your own writing and you create your own manuscript, it would be always to have like your peer review in terms of collaboration with other public health leaders who have diverse experience, somebody from different organization or from academia. I think if you can use like, I don't know, LinkedIn messaging to certain profiles that you think might be aligned with your topic and see if they are interested in collaborating with you on that specific topic. I think that this would be the ultimate, value of your manuscript in terms of expertise, peer review, and diversity in terms of the writing itself. And this will help you, will give you a better opportunity to apply to different journals. I hope I answered your question. And I just want to go back to the first question that Brittany, add to Brittany's comment. Just I want to highlight again the importance of tailoring the language to the audience needs. So it's always important to assess, the language and the literacy level of your audience and what exactly you want them to understand and how. And again, following the framework that Brittany showed in her slides, because this is key in order to develop your message, regardless of the type of public health writing you are selecting. Over.
Great. We have a question from Jim. I would like to hear your comments on the value of comprehensive review articles, not systematic reviews, that reduce selection bias through the inclusion of all of the available evidence on a specific topic. And how do you select which journal you decide to submit your manuscript?
Yeah, this is a great question. Brittany, do you want to go or I go first?
You can go first. I think that I need a moment just to think about the question.
Sure. Yeah, so again, from my personal experience, I like to read through these journals. So whenever I want to select a journal, I first go into some of their latest issues and read what kind of topics they cover, as well as the outline and the methodology they use or the style of their writing. Because sometimes, again, same as we said or mentioned in our slides, we look at the audience needs. also for these kinds of journals, we are the audience. And we are the users, so we want to make sure that it's something that we feel comfortable to apply to and match our vision or value of this public health outcome that is written in our report or manuscript. So it's very important to have this insight at the beginning, and you can try with different journals. Like at many times, I have contacted different journals to understand their styles or to share with me some of their formats, and also doing lots of literature review. The other side of your question pertaining to the bias and risks. So I think there are so many tools that are already and checklists that are available to assess risk of bias within these manuscripts. And also they are available when you go to the journal's website and check the author guidelines or instructions. Most of them, they list these checklists or kind of guidance to guide you through the process of how to do or perform these kinds of reviews, regardless if it's like systematic, thematic, or regular original, research manuscript. Over to you, Brittany.
Yeah, I think that there's like two kind of levels of evaluating which journal to decide to submit your manuscript. And I think one is thinking about where are you trying to position, your career or your subject matter expertise, for example. So for me, I'll just use myself as an example. I try to target the Journal of Health Communication or health promotion practice. And so that's one layer of, deciding which journals is where do you want to position your work? Where do you want to be seen as an expert or have your voice in the field. And then, as Chirine mentioned, once you go to those journals, you'll see the requirements for submissions are kind of listed there for you. They're pretty prescriptive. And so I would say kind of use that as a checklist to align, how you ended up writing your draft of your manuscript. Or if you want to tailor that manuscript to that journal's requirements, that's a strategy as well. But I think ultimately, each journal is going to kind of have its own set of, requirements or what they're looking for. And then I also think that there's opportunities sometimes where journals do special issues. And so you'll see a call for a special issue around a particular emerging topic. And so a lot of times that also just kind of spurs a new opportunity to potentially publish if it fits your interest in the research that you've been doing.
Yeah, I just want to add one more comment, Brittany, now based on what you mentioned. Also, one aspect that sometimes we look at when we select which journal we want to publish at is the fees, the publication fees. So I just want to mention this also because I think this is very critical, especially for those who are not affiliated also with other organizations. So every journal has some kind of maybe partial sponsorship or waiver policy. So you may check that and also double check if your organization also has some kind of membership with that journal, because sometimes they provide special rates or even waived fee for that, for any kind of for specific kind of publication. So this is key, and part of these waivers are sometimes tailored to certain countries or across the world, actually. And I tried a few. So this is something that also might, be one of the criteria that accordingly you will select your manuscript journal.
Okay.
Over.
We do have another question, and if anybody else has one, be sure to get it in. We'll take one or two more if they come up. This is from Albana asking, working in a government setting, we've had to make massive changes to all of our written reports due to updated federal language guidelines. Do you have any recommendations for maintaining simple, people-first language while still meeting current requirements? It feels like a daily balancing act.
Yeah, one of the resources, and I'll put this link in the chat too, that I really enjoy as we navigate this challenge is frameworks. And frameworks basically collaborates with, people who have to tell stories, organizations, whether they're federal or community based, as well as coalitions, to basically still change systems and shift mindsets and, inform people about these issues that we try to tackle. But they're called frameworks because they focus on the framing of your communication. So, it takes a bit of the emphasis off the semantics, and it's more about how do you frame this so that it's something that an organization or an individual would consider important or see how it impacts them and their family. So I would say that, we all understand what federal guidelines now exist and, what words are banned, for example. But we still can be creative with how you frame these issues with storytelling, with testimonials, with, comparisons. And I think that Frameworks does a really good job of showing different examples across different topics, not just health topics, but social issues more broadly. So I put that link in the chat.
All right, that seems to be our last question. I want to thank you both so much for being here and to those of you who attended as well. We appreciate your time and your interest. Um, until the next one, thank you all, and we'll see you in the future. Bye now.
Thank you, everyone.
Thank you.
Bye.
Bye-bye.